Welcome to UMCC Medical Consultants Connectors, where your health matters to us. Have you ever heard of Tinea infections? These common fungal infections can impact various parts of our bodies, from our feet to our scalps. They're not just a concern for those with compromised immune systems, but for anyone interested in maintaining their health. As we navigate through the world of fungi, understanding these infections becomes crucial. They're more than just an itch. They're a health concern we all should be aware of. Now let's delve into the different types of Tinea infections and their characteristics. First on our list is Tinea pedis, commonly known as athlete's foot. This pesky fungus tends to thrive in warm, moist environments, making communal showers and locker rooms common culprits for its spread. It can also be contracted from direct contact with an infected person or their belongings, such as towels or shoes. The typical signs of Tinea pedis include itching, stinging and burning between your toes or on soles of your feet, blisters that itch, and cracking and peeling skin on your feet, most commonly between your toes and on your soles. Diagnosis is usually done by a healthcare professional who will examine the affected skin and may also take a skin scraping to view under a microscope or to culture. Treatment usually involves antifungal medications, which can be topical or oral depending on the severity. And as for prevention, keeping your feet dry, changing socks regularly, and wearing sandals in communal areas can go a long way. Tinea pedis, though uncomfortable, can be effectively managed with appropriate knowledge and care. Next, we explore Tinea cruris and Tinea corporis, better known as jock itch and ringworm of the body. Tinea cruris, or jock itch, is a fungal infection affecting the groin area, often caused by the same fungi responsible for athlete's foot. Symptoms typically include itching and a red ring-like rash. Tinea corporis, on the other hand, is a superficial fungal infection that occurs on the body's surface. It's marked by round patches of rough, scaly skin that can itch, sting, or feel uncomfortable. Both conditions are diagnosed by examining the affected skin and, in some cases, performing a fungal culture. Treatment usually involves topical antifungal creams, while more severe cases may require oral medication. Preventing these infections mainly revolves around maintaining good hygiene, keeping skin dry, and avoiding infected individuals or animals. Despite their unsettling names, these conditions are common and can be effectively treated. Now we turn our attention to Tinea capitis and Tinea unguium, or ringworm of the scalp and nail fungus. Tinea capitis is a fungal infection that impacts the scalp, hair follicles, and occasionally the eyebrows and eyelashes. It's most commonly seen in children and can cause symptoms such as patches of hair loss, scaling, and itching. It's caused by a variety of fungi, most notably those in the Trichophyton and Microsporum families. Tinea capitis is diagnosed by examining affected hair and scalp under a microscope or by conducting a fungal culture. On the other hand, Tinea unguium, also known as onychomycosis, occurs when fungi invade the nails. This can lead to discolored, thickened, or brittle nails. It's more common in adults, particularly those with weakened immune systems or underlying health conditions like diabetes. Diagnosing Tinea unguium involves taking a sample of the nail to examine under a microscope or to culture. Treatment for both conditions typically involves antifungal medications. For Tinea capitis, this may be a topical cream or a prescribed oral medication. For Tinea unguium, treatment might include oral antifungal medications, medicated nail polish, or in more severe cases, surgical nail removal. Prevention is key. Good hygiene practices, avoiding shared personal items, and keeping the scalp and nails dry can help prevent these infections. While these conditions can cause discomfort, understanding them is the first step to effective treatment and prevention. To sum up our discussion on Tinea infections, these are common fungal conditions that can affect various parts of the body. Tinea pedis, or athlete's foot, typically affects the feet. Tinea cruris, known as jock itch, and Tinea corporis, or ringworm, usually occur on the groin and body respectively. Tinea capitis affects the scalp, while Tinea unguium, or onychomycosis, impacts the nails. Each type presents unique signs and symptoms, but they share commonalities like itching, redness, and scaling. Early recognition of these symptoms is crucial for diagnosis and prompt treatment. Antifungal medications are typically the first line of defense, but prevention is always the best cure. This includes maintaining good personal hygiene, keeping the skin dry, and avoiding shared items that may harbor the fungus. Remember, knowledge is power when it comes to preventing and treating Tinea infections. Stay informed and stay healthy. UMCC, your ultimate medical consultant connectors.